Hi, we're getting ready to do a PowerPoint presentation on bowel obstruction. My name is Brent.
Kyra.
And Sara.
Our objectives for this PowerPoint are: student nurse will understand the pathophysiology and functional causes of bowel obstruction by the end of this presentation. Student nurses will be able to list appropriate diagnostics and complications related to bowel obstructions by the end of this presentation. Student nurses will learn the manifestations of small and large bowel obstructions by the end of this presentation. Student nurse will understand the appropriate nursing care and nursing education for a patient with bowel obstruction by the end of this presentation.
Okay, so pathophysiology, what's going on? It's caused by an impaired movement of intestinal content in a cephalocaudal direction, which it means is, you eat things and it comes out, there's a stoppage in that process from eating it to being able to eliminate it. It can either be acute or chronic and is either caused by mechanical or non-mechanical. Acute obstructions typically involve the small intestines and present as severe disorder. Acute obstructions of the small intestines are going to be potentially life-threatening, so it's very important to make sure that you try to recognize the signs and symptoms, which we'll talk about later, early as possible. Chronic obstructions often involve the colon and can last for weeks to months. Mechanical is 15 to 20% of emergency department admissions. And then amongst those, it is higher in the elderly patients who are going to be coming in with abdominal pain. And small obstructions is 4 to 5 times more likely than large obstructions.
All right, complications. Some of the complications that we can see with bowel obstruction are bowel ischemia, which is caused due to the obstruction, the supply of oxygen, blood, and nutrients to the intestinal portion, and the remaining digestive tract can get cut off. We can also have peritonitis, sepsis, and shock due to electrolyte imbalance. According to our textbook, when the blood flow is compromised, it can lead to peritonitis. Bacteria without blood supply can form and release an endotoxin into the peritoneal or systemic circulation. Except from those complications, we have some complication post-surgically, which is formation of scar tissue causing future blockage, bowel leakage, abdominal bleeding, and paralytic ileus.
Alright, some functional causes of bowel obstructions. We're going to start with the mechanical obstruction. So the definition of a mechanical obstruction is when it occurs when an object from outside or inside the intestine causes a blockage. And these are going to be some examples of a mechanical obstruction. So one example is a hernia. Tumors are often very common. Bowel inflammation or swelling. Foreign matter in the intestines. Gallstones, impacted feces, volvus. Volvus is a twisting of the intestine. Intussusception, which is when the intestine pulls inward into itself, or other words, telescoping of the bowel. And carcinomas, which are one of the most common causes of large intestine obstructions. The next category we have for causes is non-mechanical obstruction. So these non-mechanical obstructions are also referred to as ileus or paralytic ileus. This is a result of the peristalsis stopping. So some examples of non-mechanical obstructions are neurogenic disorders, infection, electrolyte imbalance, which one of the big ones is going to be hyperkalemia, medications such as opioids, narcotics, and chemo, and disorders that are going to affect the muscle function.
Diagnostics. Some laboratory tests that we need to take for bowel obstruction are CBC, CMP, and serum lactate levels. With patients with emesis, we might see hypokalemic, hypochloremic, and metabolic alkalosis. Also, we might see some elevated BUN, hemoglobin, and hematocrit levels that will suggest dehydration. The leukocyte counts may be elevated if intestinal bacteria translocate into the bloodstream or if intestinal perforation has occurred. The development of metabolic acidosis, especially in a patient with an increasing serum lactate level, may signal bowel ischemia. Radiography, there is no information for the etiology of the obstruction, but it may be most valuable in patients who are hemodynamically unstable or unable to undergo cross-sectional imaging. The CT scan will help differentiate mechanical bowel obstruction from non-mechanical. Then we have ultrasound, MRI, which has a high cost, and contrast fluoroscopy.
Okay, manifestations. What are some things that we can look for to push us into the idea that this person is having obstruction going on? But not only that, but to help us distinguish whether if it's a small obstruction or a large obstruction. With the small obstruction, the patient's going to be complaining of abdominal fullness and distension. The distension is kind of mentioned as feeling like their abdomen is just getting stretched out more than normal, than what they're used to. They're going to have some vomiting, and within this vomiting, which is meaning that this blockage is really severe and has been going on for some time, may have fecal odor in it and may even be containing some fecal matter in it. They're going to be absolutely constipated, so they're not really passing anything. They're going to be another symptom is they complain of hiccups, loss of fluids and electrolytes that'll show up in their labs. They're going to be complaining of a severe abdominal pain. You might even be able to see their peristaltic waves with visually just by looking at their abdomen, and they may be in metabolic alkalosis. Large obstructions, they're going to be having intermittent lower abdominal cramping, lower abdominal distension, minimal or absent vomiting, obstipation, which means that they're not passing any, they're not having a bowel movement at all, or if they are, it's going to be ribbon-like stools, bloated abdomen, and they will be showing signs of metabolic acidosis.
Some nursing care that you can do for these patients is going to involve monitoring vital signs. That's really important to really see what's going on. And you want to assess bowel sounds. That's probably one of the most important interventions that you can provide for this patient. Another important intervention is you want to administer IV fluids and electrolyte replacement. Remember that these patients could possibly have fluid and electrolyte imbalances, so that is important to fix and replace. You want to monitor fluids and electrolytes, especially if you're giving them. Provide these patients oral hygiene, especially if they're having emesis. You want to make sure that we're really providing that good oral hygiene for them. Another intervention that you may have to do, depending on the severity of the symptoms, is you may have to decompress the intestines with a nasogastric tube. A Foley catheter may also be necessary, but another really important intervention is encouraging these patients to exercise and be mobile. So for pharmacological nursing care, you want to obviously offer these patient pain relievers. But side note on that, we know that narcotics and opioids do cause constipation, so if we can avoid those, that would be significant in their care. But if it's necessary for these patients to have that, just remember maybe the lowest dose possible may be necessary. And then for oral triple therapy, or triple oral therapy, this reduces gas, bloating, and improves symptoms. Another pharmacological intervention we can do is muscle stimulants, and what muscle stimulants do for these patients is promotes muscle contraction in the intestine, so it really gets things moving for them. And the last pharmacological thing we can do is antibiotics, so broad spectrum antibiotics, especially if you have a suspected bowel strangulation. And then for surgical, you'll do exploratory laparotomy. So those are some nursing care interventions you can do.
Patient's discharge teaching. As nurses, we need to encourage the patient to take more fluids, about 2,000 to 3,000 ml per day. Also, we need to encourage to have a balanced diet with adequate fiber, fresh fruits, vegetables, and grains. The gradual increase in fiber is recommended to prevent abdominal discomfort, and the recommendation for fiber intake is 20 grams per day. We also encourage the patient to have frequent exercise and bowel training, in addition to oral hygiene, which helps promoting the interest in drinking and reduces discomfort of dry mucous membranes. Lastly, we discourage the frequent use of laxatives because it can decrease abdominal muscle tone.
So how much have we learned? First question. A nurse is assessing a client who has been admitted with the diagnosis of an obstruction in the small intestines. The nurse should assess the client for, select all that apply. A, vomiting that may contain fecal matter. B, ribbon-like stools. C, copious diarrhea. D, hiccups. E, peristaltic waves. Answer is A, D, and E.
Alright, so our second NCLEX question is, a student nurse is currently studying gastrointestinal disorders for her upcoming exam. During a clinical rotation, she is assigned to a patient who is diagnosed with a bowel obstruction. The student nurse decided to ask her instructor what are some causes associated with intestinal obstruction. Which of the following should the instructor include? You want to select all that apply. A, tumor. B, hydronephrosis. C, hernia. D, scar tissue from previous abdominal surgery. And E, deep vein thrombosis. Go ahead and pause your screen and try to figure out the answer. The answer is going to be A, tumor. C, hernia. And D, scar tissue from previous abdominal surgery. Great job.
NCLEX question number 3. A 40-year-old patient with a bowel obstruction is being discharged home this afternoon. The nurse is preparing the patient for discharge and asks the patient to use the teach-back method. Which statement by the patient indicates the need for further teaching? A, I should balance my diet by eating food with more fiber. B, I will avoid laxatives as much as possible. C, I will drink 5 to 7 glasses of water a day. D, I will start going on walks in the evening with my dog. Please pause your screens and try to figure out the answer. The answer for this question is number C. I will drink 5 to 7 glasses of water a day.
And here are some pictures that you can just take a look at on your own time. And we want to thank you for checking out our presentation. Have a wonderful day.